Sciatica is a term that people use to refer to pain that comes from the back and goes down into the legs. And really people will say it's a pain that they feel in their back, and it'll go down into their buttock, down the back of their leg, and can even go down into the foot. And really what is causing that is compression of the nerves of the low back. The sciatic nerve is a nerve that comes off the lower spine and is made up of a collection of nerves in the spine. When you get a disc herniation or severe arthritis in your back, it can compress one of those nerves, and depending on which one is being compressed, you will feel pain, numbness, burning, either in the buttock or down the leg. Depending on how much that nerve is being compressed, you can also get some weakness in the leg even. So sciatica can be brought on by a number of different factors. It's often related to disc degeneration over time with things like genetics, smoking, wear and tear over time, but certainly can be brought on by an injury also, or even just long-term arthritis. If a disc is degenerated and herniates and presses on one of the nerves of the low back, it will cause a sciatic type pain which goes down into the leg. So with sciatica, people will often feel back pain, is usually the first symptom they will feel. It'll then often go down into the legs and can be a shooting, burning type pain that they'll feel. Sometimes people will have numbness, and sometimes they'll even have weakness in the legs. For disc herniations and sciatica, the first treatment is always going to be simple things like lifestyle modification. So avoiding things that aggravate it. And people often say picking things up, bending, twisting can often aggravate it. The next treatment would be simple anti-inflammatories that you can get over the counter at a drugstore. If those are not providing relief, then it's time to switch to prescription anti-inflammatories and physical therapy. Usually those will be enough to help people get over the pain until the body naturally resorbs the disc or removes the compression on that nerve. And if they're not, then we can try things like an injection with a steroid that is placed right onto the nerve. There are a number of surgeries that can be done for sciatica, and it really depends on where the compression is, what nerve is being compressed, and what your overall spine health looks like. It can be anything as simple as a decompression where we just go in and take out that piece of disc to a larger fusion type surgery. And again, it is multifactorial as to which surgery would be recommended and why.